Hello class, and welcome to This Week in Health Psychology. I am your instructor, Dr. Neil Soggie. This week we will be examining the background against which health psychology developed in terms of the traditional biomedical model of health and illness that emerged in the 19th century, as well as changes in perspectives of health and illness over the 20th century. So the background to health psychology really can be dated back to the 19th century, where modern medicine was established. Back then, the term man was used to describe humanity, and the study of man included using dissections, physical investigations, and medical examinations. And Darwin's thesis, The Origin of Species, was published in 1856 and described the theory of evolution. Now, this revolutionary theory identified a place for man within nature and suggested that we are a part of nature, that we developed from nature, and that we are biological beings. This was in accord with the biomedical model of medicine, which studied man in the same way that other members of the natural world had been studied in earlier years. And this model described human beings as having a biological identity in common with all other biological beings. So what is the biomedical model? The biomedical model of medicine can be understood in terms of its answers to the following questions. So the first question, what causes illness? According to the biomedical model of medicine, diseases either come from outside the body, they invade the body, and cause physical changes within the body, or they originate as internal, involuntary physical changes. Such diseases may be caused by several factors, such as chemical imbalances, bacteria, viruses, and genetic predisposition. So, who is responsible for illness? Because illness is seen as arising from biological changes beyond their control, individuals are not seen as responsible for their illness. They are regarded as victims of some external force causing internal changes. So how should illness be treated? The biomedical model regards treatment in terms of vaccines, surgery, chemotherapy, and radiotherapy, all of which aim to change the physical state of the body. So who is responsible for treatment? Really, the treatment responsibility rests with the medical profession within the biomedical model. When we look at what is the relationship between health and illness within the biomedical model, health and illness are seen as qualitatively different. You are either healthy or ill, and there's no real continuum between the two. So when we look at the relationship between the mind and the body, according to the biomedical model of medicine, the mind and body function independently of each other. And this is comparable to a traditional dualistic model of the mind-body split. From this perspective, the mind is capable of influencing physical matter, and the mind and body are defined as separate entities. The mind is seen as abstract and relating to feelings and thoughts, and the body is seen in terms of physical matter such as skin, muscles, bones, brain, and organs. Changes in the physical matter are regarded as independent of changes in state of mind. So when we look at the role of psychology in health and illness within this traditional biomedical model, illness may have psychological consequences, but not psychological causes. So, for example, cancer may cause unhappiness, but mood is not seen as related to either the onset or progression of the cancer. When we look at the 20th century, there are many challenges to some of the underlying assumptions of the biomedical model. And these developments include the emergence of psychosomatic medicine, behavioral health, behavioral medicine, and, most recently, health psychology. And these different areas of study illustrate an increasing role for psychology in health and a changing model of the relationship between the mind and the body. When we go back and look at psychosomatic medicine, the earliest challenge to the biomedical model was psychosomatic medicine. And this was developed at the beginning of the 20th century, really in response to Sigmund Freud's analysis of the relationship between the mind and physical illness. At the turn of the century, Freud described a condition called hysterical paralysis, whereby patients presented with paralyzed limbs with no obvious cause, and in a pattern that did not reflect the organization of nerves. So Freud argued that this condition was an indication of the individual's state of mind, and that repressed experiences and feelings were expressed in terms of physical problems. And this explanation indicated an interaction between mind and body, and suggested that psychological factors may not only be consequences of illness, but may contribute to its cause. Then there's behavioral health, and behavioral health again challenged the biomedical assumptions of a separation of the mind and body. Behavioral health was described as being concerned with the maintenance of health and prevention of illness in currently healthy individuals through the use of educational inputs to change behavior and lifestyle. The role of behavior in determining the individual's health status indicates an integration of the mind and body. Then comes behavioral medicine, and a further discipline that challenged the biomedical model. And this could be described as an amalgam of elements from the behavioral sciences. So, behavioral medicine brings in psychology and sociology and health education, and focuses on health care and treatment and illness prevention. So behavioral medicine has also been described as consisting of methods derived from the experimental analysis of behavior, such as behavior therapy and behavior modification, and really involves the evaluation of and treatment and prevention of physical disease or physiological dysfunction. So things like hypertension, addictive behaviors, and behaviors that contribute to obesity. It has also been emphasized that psychological problems such as neuroses and psychoses are not within behavioral medicine unless they contribute to the development of illness. Overall, behavioral medicine will include psychology in the study of health and really departed from traditional biomedical views of health by not only focusing on treatment, but also focusing on prevention and intervention. And in addition, behavioral medicine challenged the traditional separation of the mind and body. So when we look at health psychology is probably the most recent development in this process of including psychology in an understanding of health. It's really an aggregate of the specific educational, scientific, and professional contributions of the discipline of psychology to the promotion and maintenance of health. And really the promotion and treatment of illness and all of its related dysfunctions. So health psychology, again, challenges the mind-body split by suggesting a role for the mind in both the cause and treatment of illness, but differs from psychosomatic medicine, behavioral health, and behavioral medicine in that research within health psychology is more specific to the discipline of psychology. Health psychology can be understood really in terms of the same questions that were asked by the biomedical model. So, for example, what causes what causes illness? Health psychology suggests that human beings should be seen as complex systems, and that illness is caused by a multitude of factors and not a single causal factor. Health psychology, therefore, attempts to move away from a simple linear model of health and claims that illness can be caused by a contribution of biological, so things like bacteria, a virus, and psychological behaviors, beliefs, and social, employment, financial factors. And this approach reflects the biopsychosocial model of health and illness, which was developed in the late 1970s and early 1980s. And the biopsychosocial model represented an attempt to integrate the psychological, the psycho, the environmental, the social, into the traditional biomedical model, the bio model of health. So within this biopsychosocial model, the bio contributes factors including genetics, viruses, bacteria, and structural defects. The psycho aspects of health and illness are described in terms of cognitions, so expectations of health, emotions, fear of treatment, behaviors, things like smoking, diet, exercise, or alcohol consumption, and the social aspects of health in terms of social norms of behavior. So expectations to smoke or not to smoke, pressures to change behavior, so peer group expectations or parental pressures, and social values on health. So, for example, whether health was regarded as a good or bad thing, as well as things like social class and ethnicity. So, when we look at questions asked by health psychology, we see those same kinds of questions. Who's responsible for illness, for example? Because illness is regarded as a result of a combination of factors, the individual is no longer simply seen as a passive victim. For example, the recognition of a role for behavior in the cause of illness means that the individual may be held responsible for their health and illness. How should illness be treated is another question. Now, according to health psychology, the whole person should be treated, not just the physical changes that have taken place. This can take the form of behavior change, encouraging changes in beliefs and coping strategies in compliance with medical recommendations. So who is responsible for treatment? Because the whole person is treated, not just their physical illness, the patient is therefore in part responsible for their treatment. And this may take the form of responsibility to take medication, responsibility to change beliefs and behaviors. They're not seen as the victim in essence. So what is the relationship between health and illness? From this perspective, health and illness are not qualitatively different, but really they exist on a continuum. Rather than being either healthy or ill, individuals progress along this continuum from healthiness to illness and back again. So then we can ask the question, what is the relationship between the mind and the body? The 20th century has seen a challenge to the traditional separation of mind and body, suggested by a dualistic model of health and illness, with an increasing focus on an interaction between the mind and the body. And this shift in perspective is reflected in the development of a holistic or a whole person approach to health. So health psychology will maintain that the mind and body really do interact. However, although this represents a departure from the traditional medical perspective, in that these two entities are seen as influencing each other, they are still categorized as separate. The existence of two different terms, the mind and the body, suggest a degree of separation, and an interaction can only occur between distinct structures. So what then is the role of psychology in health and illness? Well, according to health psychology, psychological factors not only are possible consequences of illness, but also contribute to the etiology, so the source or cause of an illness. So what are some aims of health psychology? Well, health psychology emphasizes the role of psychological factors in the cause, the progression, and consequences of health and illness. The aims of health psychology can be divided into, first off, understanding, explaining, developing, and testing a theory, and secondly, putting this theory into practice. So health psychology really aims to understand, explain, develop, and test theories. And they do this by evaluating the role of behavior in the etiology, that is the source or cause of the illness. So, for example, coronary heart disease is related to behaviors such as smoking, food intake, and lack of exercise. Many cancers are related to behaviors such as diet, smoking, alcohol, and failure to attend for screenings or health checkups. A stroke is related to smoking, cholesterol, and high blood pressure. And an often overlooked cause of death is accidents, and these may be related to things like alcohol consumption, drugs, and careless driving. There can also be predicting unhealthy behavior, so for example, smoking, drug or alcohol consumption, high-fat diets, and all the related beliefs that surround these activities, as well as beliefs about health and illness. And all of this can help predict behavior. So overall, evaluating the interaction between psychology and physiology is another interest of health psychology. So for example, the experience of stress relates to appraisal, coping, and social supports. Stress leads to physiological changes that can trigger or exacerbate illness. Pain perception can be exacerbated by anxiety and reduced by distraction. So understanding the role of psychology in the experiences of health can go a long way to helping people. So, for example, understanding the psychological consequences of illness can help to alleviate symptoms, such as pain, nausea, and vomiting. Understanding the psychological consequences of illness can help alleviate psychological symptoms, such as anxiety and depression. And evaluating the role of psychology in the treatment of illness. So, for example, if psychological factors are important in the cause of illness, they may also have a role in its treatment. Changing behavior and reducing stress could reduce the chances of a further heart attack. And treatment of the psychological consequences of illness may have an impact on longevity in life. So health psychology also aims to put theory into practice, and this can be implemented by a promotion of healthy behavior. So, for example, understanding the role of behavior in illness can allow unhealthy behaviors to be targeted. Understanding the beliefs that predict behaviors can allow these beliefs to be targeted. Understanding beliefs can help these beliefs to be changed. Preventing illness, for example. Changing beliefs and behavior can prevent illness onset. Modifying stress could reduce the risk of a heart attack. Behavioral interventions during an illness, so for example, stopping smoking after a heart attack, may prevent further illness. And training health professionals to improve their communication skills and to carry out interventions may help to prevent illness. So overall, what is the future of health psychology? Health psychology is really expanding in the English-speaking world, in India, in Canada, in the UK, across Europe, in Australia and New Zealand, in South Africa, and in the US. So for many students, this involves taking a health psychology course as part of their psychology degree. For some students, health psychology plays a part of their studies. For other allied disciplines such as medicine, nursing, health studies, dentistry, addiction studies. However, in addition to studying health psychology at a preliminary level, an increasing number of students carry out higher degrees in health psychology as a means to develop their careers within this field. And this has resulted in a range of debates about the future of health psychology and the possible roles for health psychologists. Now, to date, this debate has highlighted two primary roles and pathways. First off, the clinical health psychologist, and second, the professional health psychologist. Now, within the clinical health psychologist, this is really a clinical psychologist that has incorporated health studies into their field, where they're merging clinical psychology with its focus on abnormal psychology and on the assessment and treatment of individuals in distress, and the content of the field of health psychology. Now, in order to practice as a clinical health psychologist, it is generally accepted that someone would first gain training as a clinical psychologist and then later acquire an expertise in health psychology, which would involve an understanding of the theories and methods of health psychology and their application to the healthcare setting. A trained clinical health psychologist would tend to work within the field of physical health, including stress and pain management, rehabilitation for chronic patients, those suffering, for example, from cancer or cardiovascular disease, or the development of the interventions for problems such as spinal cord injury or disfiguring surgeries. Then there is a professional health psychologist, and a professional health psychologist is really someone who is trained to an acceptable standard in health psychology and works as a health psychologist. So within the UK and the British Psychological Society has sanctioned the term chartered health psychologist. And across Europe and in Asia and Canada and the US, the term professional health psychologist, or simply health psychologist, is being used more and more commonly. Now, although still being considered by a range, there is some agreement that a professional health psychologist should have competence in three main areas. First, research, teaching, and consultancy. And in addition, they should be able to show a suitable knowledge base of academic health psychology, normally by completing a higher degree in health psychology and having demonstrated that they meet the required standards. A professional or chartered health psychologist could work as a academic, being a professor or instructor, or they could work within health promotion settings in a health district, or they could work in schools or industry, or work within a hospital setting where they're part of the education process. Overall, the aims of health psychology really expanding into all of the areas of teaching, research, and practice. And health psychology really occurs in its training at both the undergraduate and graduate level. And that, I think, is a positive thing that will continue. So finally, what I want to leave you with is this. The theory in health psychology, what health psychology draws upon is really a range of psychological perspectives for its theory. So, for example, it uses learning theory when it's emphasizing the associations and modeling. It looks at social cognition theories with their emphasis on beliefs and attitudes. It looks at stage theories with their focus on change and progression. It looks at decision-making theory, highlighting a cost-benefit analysis and the role of hypothesis testing and physiological theories with their interest in biological processes and their links with health. Further, it utilizes many key psychological concepts such as stereotyping, self-identity, risk perception, self-efficacy, and addiction. So I just want you to keep in mind that this is going to be a wonderful course that really helps us to explore many different aspects of health and inevitably aspects of your own life as well. So I hope you enjoy. That's the end of our lecture for this week, and I will see you next week as we explore research into health beliefs in health psychology.